I'm calling to order this hearing for public roundtable of the Committee of the Whole of the Council of the District of Columbia. I'm Phil Mendelson, Chair of the Council and Chair of the Committee of the Whole. Today is Wednesday, October 30th, 2024. The time is 10:14 in the morning. We're in room 412 of the Johnny Wilson Building. This hearing is available via the council's website, www.dccouncil.gov. The subject of this morning's hearing is consideration of 6 appointments by the council to the Commission on Health Equity. The Commission on Health Equity was established to provide comprehensive recommendations to the Department of Health, the council, and the mayor on addressing health inequities across the district. It consists of strategically positioned leaders with expertise in areas like health equity, social determinants, and health disparities, social and human services and vulnerable populations, early learning and education, minority communities and population health outcomes and improvement, economic and community development, and ecology and the natural and built environment. The goal of the commission is to address disparities in healthcare access across different demographics and wards. The 6 nominations that are before us today, and these would be appointments by the council, not confirmations of mayoral nominations, are PR 25-941, Commission on Health Equity, Delia Hausil, reappointment resolution of 2024. And I believe Ms. Hausil is participating virtually, although she needs to accept. PR 25-942, Commission on Health Equity, Austin Hicks Chiquindo, appointment resolution of 2024, and he will not be participating today, so will not be participating today. So when I adjourn this roundtable, we will reschedule for Ms. Chiquindo. The third is PR 25-943, Commission on Health Equity, Dr. Nura Green Lane, appointment resolution of 2024. She gets a gold star before we've even begun the hearing because she's in person. PR 25-944, Commission on Health Equity, Kimberly Burrows, appointment resolution of 2024, and I believe she'll be participating virtually. PR 25-945, Commission on Health Equity, Nikisha Neal Jones, appointment resolution of 2024, also a gold star being here in person. And PR 25-946, Commission on Health Equity, Yvonne Garces, appointment resolution of 2024. And that person is also unavailable today, so we'll have to reschedule. As I said, these are resolutions that, if adopted by the council, would be the council adopting these 6 individuals. If I remember correctly, 7 members of the commission are appointed by the mayor with confirmation by the council. I might be off on that number, and 6 are appointed by the council. With that, we have the chair of our health committee here. These are in the committee of the whole because these are appointments by the council, but the mayoral nominations go through the committee on health. Councilmember Henderson, do you have any remarks?
I do. Thank you, Mr. Chairman. And thank you for holding this roundtable and moving forward with these nominations today. The council, moving forward with these nominations that the council has nominated for the Commission on Health Equity. I believe that each of these individuals are qualified and will bring valuable expertise and perspectives currently missing from the commission. As you might have mentioned, and as the public may know, the Commission on Health Equity was established in 2016 to examine health inequities in the district with an emphasis on social determinants of health and a special focus on vulnerable populations. The committee is tasked with producing reports on its findings and advising DC Health, as well as the council and the mayor, on the best ways to advance and achieve health equity. The commission spearheaded the publication of the groundbreaking DC Health Equity Report in 2018 and supported DC Health in organizing the DC Health Equity Summit in 2021. Due to DC Health's shifting priorities and focus during the pandemic, the commission disbanded for several years. But the energetic new director, Dr. Ayana Bennett, and the Office of Health Equity Director, Dr. Annetta Arno, have decided to reconvene and refresh the commission. The council voted to appoint the mayor's nominees to this Reform Commission earlier this summer, and now we have before us the council nominations. According to the legislation that created this commission, the council is tasked with appointing 3 voting members and 3 non-voting community advisory members, 1 from wards 5, 7, and 8. I look forward to hearing their testimony today, and I thank you so much for holding this hearing. Thank you.
Thank you. So we have at the table Dr. Lane and Ms. Jones, and we have virtually Ms. Hasil and Ms. Burrows. So why don't we begin with testimony? I'll go in the order that I have, I guess, that I have them listed on the witness list. So Dr. Hasil, do you want to begin? Or would you begin? Or please begin? You are muted.
I'm sorry. Can you all hear me now?
Yes.
Awesome. All right. So good morning, Chairman Mendelson and Councilmember Henderson and staff. My name is Dr. Delia Housel, and I'm a proud resident of the Marshall Heights community in Ward 7. I respectfully request your support for my reappointment to the Health Equity Commission of the District of Columbia. My commitment to health equity began as a teenager in South Carolina, where I witnessed my parents navigate a healthcare system that was riddled with biases. This experience inspired me to become deeply interested in healthcare, healthcare justice, and equity. So in 1997, I moved to Washington, D.C. to attend Howard University, where I deepened my understanding of how institutional and systemic racism affects health outcomes, and I had an opportunity to refine my advocacy skills. After earning my Bachelor's of Science, I taught at Wilkinson Elementary School in Ward 8, where I experienced firsthand the consequences of educational disparities. While teaching, I pursued a Master's of Public Health at George Washington University, where I focused on disease prevention and health promotion. My journey in public health began with an internship at Healthcare Now, which is a Ward 7-based healthcare advocacy organization, where I worked as a healthcare navigator, connecting vulnerable residents to healthcare resources and supports to help improve access to primary care services. I then transitioned to the DC Department of Health, where I had an opportunity to analyze maternal and child healthcare outcomes as an intern and serve as a full-time public health analyst in the Diabetes Prevention and Control Program. During this time, I worked along my colleagues, and we were able to conduct some pioneer research on reducing diabetes disparities among African American males in the district, where I had an opportunity to lead several national presentations and was able to co-author the city's first strategic plan, which addressed cardiovascular, diabetes, and kidney disease disparities. I then transitioned to the federal sector, where I focused on minority representation and research, and I earned my PhD in public health from Walden University. My concentration of research was on food insecurity and diabetes outcomes. And so recognizing that systemic policy changes are essential to addressing social determinants of health, I shifted my focus to health policy, which is where I am now. And so over the past 10 years, my work has really centered on developing innovative solutions to tackle population health issues and improve access to quality care through innovative payment models. Additionally, I serve as an advisory neighborhood commissioner for single-member District 7006, where I advocate for 2,000 residents of the Marshall Heights community. And so I believe that my diverse experience uniquely positions me to contribute to the Health Equity Commission. Over the last few years, as a member of the Health Equity Commission, we were not able to do all the things that we wanted to do. So I'm really happy to hear that Dr. Arnold and others are looking to revamp and strengthen this committee, because I do believe that it has an incredibly important mission. And with the right people at the table can contribute tremendously to improving and tackling health equity within the district. And so I am eager to continue to bring my perspective to addressing health equity in a way that I believe is responsive to the district's diverse needs. And so thank you for this opportunity to testify. I hate that I can't be there in person, but I look forward to answering any questions that you have.
Thank you, Dr. Hastil. Dr. Lane?
Can you hear me?
Yes.
Good morning. Thank you. Thank you to Chairman Mendelson and Councilwoman Henderson and the other council's members. I'm deeply honored to accept the nomination to serve as a commissioner for the DC Office on Health Equity. My commitment to this role is grounded in my Buddhist values and personal philosophy, shaped by Ralph Waldo Emerson's words, success, to leave the world a bit better, whether by a healthy child, a garden patch, or a redeemed social condition. This is to have succeeded. This ideal has guided my life's work, a work centered on advancing the well-being of all people, particularly in addressing the racial and economic disparities that persist in health and wealth outcomes across the District of Columbia. For over 3 decades, I have worked tirelessly to address social determinants of health that disproportionately impact marginalized Black and Brown communities in our city. My dedication is not about recognition. It is driven by a profound sense of responsibility to create lasting, meaningful change in neighborhoods where race and economics have long shaped outcomes. As a 4th-generation Washingtonian, I am committed to a future where every child, including my own, can grow up in a community that is safe, supportive, and free from the social barriers that have historically limited our residents. Through my work with the DC Prevention Center for Wards 7 and 8, supported by BRIC Incorporated, we have over 300 residents have been certified to administer naloxone, a life-saving opioid overdose reversal medication, with many more benefiting from substance use prevention, education, and harm reduction resources. As a commissioner, I will champion policies and actions that distribute equitable funding to population health, behavioral health, substance use programs, while also working to remove barriers within DC agencies that hinder access to essential health services and resources for our residents, especially those living in wards 5, 7, and 8, our most vulnerable and marginalized populations. In this role as a commissioner, I hope we will contribute to updating the DC Health Equity Report with insights that reflect our present-day challenges, including the long-term impact of COVID-19, the opioid crisis, increasing gun violence, and the maternal mortality disparities. Together, we must commit to a shared understanding that every resident in DC deserves the opportunity to live, grow, and thrive in safe and healthy neighborhoods. I look forward to collaborating with my fellow commissioners to drive equity and to ensure resources are distributed in ways that affirm the inherent value of every life in the District of Columbia. This vision of success fuels my commitment to making our community and our world a better place. Thank you.
Thank you, Dr. Lane. Kimberly Burrows, who's virtual.
Thank you. Can you all hear me?
Yes.
Great. Good morning, everyone. It's with deep appreciation that I'm among all of you today. My name is Kimberly Burrows, and I'm nominated to serve on the Commission for Health Equity. I'm a Senior Manager of Training and Technical Assistance at the Urban Institute, which is a nonpartisan social and economic research organization based here in Washington, D.C. At the Urban Institute, I'm in the Research to Action Lab, which is a policy division that leverages the breadth and depth of research and evidence-based practices to engage directly with policymakers and local decision makers to provide data-driven recommendations. In my training and technical assistance work, I equip change makers with the necessary knowledge, skills, and tools to identify and implement solutions to address local challenges. I'm a community planner by training, and my research focuses on park equity, placemaking, and upward mobility for residents. In my work, I specifically explore how parks and green spaces contribute to community and individual benefits, such as physical and mental health, social well-being, and environmental outcomes. I focus my research on the equity gap to uncover who has access to these spaces. As a result of past policies and planning practices, there has been disinvestment in green amenities in communities of color and low-income communities across U.S. cities. My work elevates possible practices for local policymakers, advocates, urban planners, and community organizations to employ in improving access to quality park amenities. As a member of the Commission of Health Equity, I plan to bring the evidence base of how parks and green spaces impact health outcomes as the Council considers local investments. Thank you.
Thank you, Ms. Burrows. And Nikisha Jones.
Good morning, Chair Mendelson, Councilmember Henderson, other members of the City Council and staff. Thank you for considering my nomination to the Mayor's Commission on Health Equity. I am Nikisha Neal Jones, and DC is home for me. I was born in the Great Ward 8. I have lived in Ward 7 for most of my life. I love the district, and my entire career has been focused on helping more DC residents access opportunities related to housing, workforce development, community health, and personal leadership development. I currently serve as Executive Director of Black Women Thriving East of the River, an organization focused on reducing cancer mortality, increasing health-related workforce success, and lifting the narrative that some Black women who live east of the Anacostia River in Washington, D.C. are thriving and more can thrive. This work is necessary because of longstanding disparities in healthcare and workforce development. For example, Wards 7 and 8, where 87% of residents are Black, have the highest cancer incidence and mortality rates in the district. In Ward 8, the cancer mortality rate is approximately 25%, while this rate in Ward 3, a ward that's 80% white, is significantly lower at 11%. Unfortunately, the fact that white households have 81 times the wealth of Black households in DC is also a familiar statistic. Black Women Thriving East of the River was started by women who lived in or had deep connections to East of the River communities. They used root cause analysis to understand why there are inequities in healthcare and workforce systems and how we can address them. Those recommendations guide the work that we do at Black Women Thriving and how we lift up new programs and priorities. I look forward to bringing this way of working to the Commission on Health Equity to change this story in healthcare, workforce development, and across the board with social determinants of health. My lived experience, professional experience, and collaborative leadership will support the team that is already working diligently to address disparities across all 8 wards. No organization, community, or sector can do this work effectively and alone. Thank you.
Thank you, Ms. Jones. And as I said earlier, Yvonne Garces, who's the last person on the witness list, was not able to make it today, so we will reschedule for her. I'm going to have some questions, and I'll turn to Councilmember Henderson. And I'm going to begin with Dr. Hasil. In your response to the pre-hearing questions, you noted that there have been some significant challenges with the commission. One of the primary issues has been the inconsistent scheduling of meetings, which has made it difficult for members to participate and has hindered our ability to be effective. Additionally, there's been a lack of strong and consistent leadership resulting in no clear goals or actionable steps for the committee to take. Now, the mayor just sent down nominations, which we confirmed, as Councilmember Henderson said, in the summer. So we're seeing some changes and new people on the commission. What do you expect that these challenges will improve, and could you speak more to this? You're muted.
Sorry, forgot I'm double muted. I'm hopeful that with a new, with the onbringing of new commissioners and a renewed interest in the committee, that we will be able to meet regularly and really get into fulfilling the mission of the commission, excuse me. And so I know that more recently there's been some new leadership assigned on the commission, and we've actually been meeting we've met twice now this year, which is a significant improvement than what had occurred throughout my previous tenure. So I'm confident that with these new leadership changes, that the commission will be able to fulfill its mission.
And about how much time, so it may be hard to answer this question given what you were saying, how much time is required to be on the commission?
It actually ended up being much less than what I had anticipated. Currently, the commission meets quarterly, or that is what the plan was. I know at some of our most recent meetings, many of the individuals at the table discussed meeting a little bit more frequently, at least until we are all clear about what key actions and goals the commission was going to take on over this term. And so I would say that it probably takes no more than about 20 hours a year. Honestly.
You were anticipating more than that.
Yeah, I was anticipating a little bit more, and I think that's just probably me really wanting to get more involved. There are a lot of health, when I think about health equity in the district, there are so many different areas of need. And so for me, I felt like, we were going to be meeting a little bit more frequently and map out a plan and have subcommittees. And I know we were unable to do those things, but it's my understanding that moving forward, these are some of the things that the commission will be pursuing.
So I'm going somewhere with this line of questioning. So how much time do you think will be involved? So if it was like 20 hours last year, this year, 40, 60 hours?
Okay. Yeah, I think about 40, 50 hours. I definitely can, as I mentioned, we've already had, since the summer, we've had 2 meetings, which were very positive meetings, and we spent a lot of time together and talked. So I do think about 40 hours would be reasonable.
So that's not quite monthly, the meetings.
No, that wouldn't be quite monthly.
And how long are the meetings?
They range from, depending on discussion, they can range anywhere from an hour to 2 to 3 hours.
Okay. So here's the question I'm leading up to. Do you, knowing that, do you have the time to serve? If you're reappointed, do you have the time to serve?
Yes, I do have the time to serve.
And Dr. Lane, do you have the time to serve?
Yes.
And Ms. Burrows, do you have the time to serve?
Yes, I do. Thank you.
And Ms. Jones, do you have the time to serve?
Yes.
I was going somewhere with that line of questioning. I think in the pre-hearing questions, we might have asked about possible conflicts of interest. I always ask this question at hearings or the nominations. Do you think there might be a conflict of interest? Not that, in my view, that would be disqualifying, but please answer whether you think there might be a conflict of interest that comes up, and if there were to be, how you would handle it. And I'll start with Dr. Halseel.
Awesome. Yeah, given my current work, I do not believe there would be a conflict of interest, but obviously if one were to arise, I would immediately notify my fellow commissioners of the potential conflict. And if any actions or decisions were to be made on an issue where I may be a conflicted party, I definitely would not be taking any sort of official action. So I would recuse myself from any sort of official actions or even discussions. I would probably not engage in any discussions around an issue where there may be a conflict of interest.
So you would identify it and then recuse yourself.
Yes, absolutely.
Dr. Lane, same question. I note in the pre-hearing answers, you stated that your husband is Chair, Ambrose Lane is Chair of the Health Alliance Network. I don't know that I see that as a conflict, but well, maybe you could say a little bit more about that and whether there could possibly be any other conflict of interest and how you would handle it.
Just like Dr. Housel mentioned, any conflict, I would definitely bring it to the attention of my fellow commissioners. And if it's needed, I will recuse myself from it. My husband is Ambrose Lane Jr. He does a lot of the advocacy work. And there are times that the commission may take a position on something that may be counter to what he does. I don't see that as a problem. Generally, we do talk about health all the time in our household, but it would not be a problem if there was something that needed to be discussed among commissioners, for commissioners, about an action that we will take that would be within us, when the scope of the work that I would do with the commissioners, independent of husband and wife conversation. So I don't see any conflict. Any other conflict that may arise as well, again, I would be taking the ethical course of action to ensure that everyone knows what that would entail. And I would take a step back if needed on that.
And recuse yourself.
And recuse myself, of sure.
Ms. Burrows? Same question.
Yes, based on the types of committees and boards that I sit on right now, several of them are within the community development space. Others are also, I have another one that's based internationally in my home country of Jamaica. And so I don't anticipate any conflicts of interest. Given that social determinants of health is a very broad area, particularly when we're talking about health equity, if there were to be any conflict of interest, similar to Dr. Lane and Dr. Housel, I would similarly identify to my fellow council members where I'm seeing that challenge arise and then recuse myself from all decisions. I particularly think about this when I consider my job at the Urban Institute. We do have several health policy folks. If we are going after any funds that are related to DC Health, I would not participate in any of those awards or any of those proposals.
Thank you. And Ms. Jones?
Thank you. So I don't have any current conflicts. We do at Black Women Thriving East of the River work with DC Health, the DC Cancer Coalition. We are currently in discussions. It has not been finalized about a peer mentoring program that may happen in collaboration with DC Health and a couple of other partners in community. Our work is focused on disparities, and I think it's great in terms of alignment and collaboration. If at any point, I needed to be clear about our participation in a specific area or felt like there was a conflict or an actual, even an appearance of conflict, I didn't put the grant discussion on the forum because we don't yet have anything that's been finalized. But certainly that is something that we would bring up and present and be very open about. And I don't think that it's something that would interfere with my ability because this work is really important, that it not be limited to one particular area or group. It's so important that we connect the dots on the different issues that we're bringing in terms of expertise. And so I think because, like Ms. Burrows says, it's so broad, we all might be working in specific areas, yet I really don't think there's anything that's an ethical issue at this point. And if something did come up that was questionable, I would bring that up.
And you would disclose it, and if it was a conflict, to recuse yourself.
Yes, absolutely. Thank you.
I do want to note that a conflict of interest under DC laws essentially involves getting something of value.
Mhm.
So if we're just talking about issues and agreeing or disagreeing with our husband, that's not there's no financial benefit in that. Third question, I always ask this of nominees current in taxes, and I'd asked this in the pre-hearing questions. And a couple of the nominees indicated that you have payment plans. If you're current in a payment plan, then as far as I'm concerned with regard to the question, you're current in your taxes. So let me ask each of you. Dr. Hasil, are you current in your taxes and any other liabilities to the district or federal governments?
Yes, I am.
And Dr. Lane
Yes, I am current.
and Ms. Burrows
Yes, I am.
and Ms. Jones.
Yes.
Thank you, each of you. Councilmember Henderson, do you have questions?
Thank you, Mr. Chairman. I do have some questions, and I just want to note for the record, the Commission on Health Equity doesn't have any grant funding that's been appropriated to it. So in terms of conflict of interest of granting, there is no money there at the moment. Want to talk about a couple of things. So Dr. Lane, when I was making recommendations to the chairman of folks to appoint to the commission, thought it was super important that we have someone with some expertise in opioids and substance use disorder, given what the district is currently experiencing now. How do you think the Commission on Health Equity can further drive forward the conversation on effective solutions around the opioid crisis?
Well, as a matter of fact, today is the quarterly discussion we have with Live Long DC, which is the DC agencies all get together to talk about the opioid crisis, learn about what's going on and how people are engaged in this work and some practices that are coming up. It is quite important that we include, and I hope that we will be able to update the health equity report just to see the impact of the opioid crisis and how that has shortened life expectancy, especially in 5, 7, and 8 and across the city because everybody is impacted. And so we really need to see what that really looks like. And on the other end of that is also talking about prevention, because that's where I'm from. That's what I work in. BRIC is funded through the Department of Behavioral Health to do this outreach work, to do the prevention work, and to have a greater understanding of what prevention science is and how that really lends to the equity issue. And we can address that. So I do believe that it is important that we know what that really looks like in the impact of the opioid crisis, but even as the numbers go down, there will be something more. And so reducing that and preventing further use and prevention of young people is critical. And so I think that's very important.
Great. You'll be representing Ward 7 on the commission. What do you believe are the most pressing health equity issues for that community that you'll raise at the commission?
Of course, it's definitely substance use and mental health, but it's also gun violence and the impact of health access to food security and housing.
Yeah.
And then you can't have it without economics, right?
Right. You've covered the
All the
gamut,
social determinants.
all the social determinants.
But those are real things because I don't have to go far in my community to see what is needed.
Yeah.
I see it.
Thank you. Ms. Burrows, when we were moving the mayor's nominees for the commission, we were doing that through the Committee on Health. I was struck by one category of expertise named in the original legislation that was entirely missing from the nominees that we had, which was expertise in ecology and the natural and built environment. Can you describe how your work highlights the impact of the natural and built environment on health equity in the district?
Sure. I would just start out by saying that everything is just so steeped in place and where we live. And so my work really does that hyper-local focus of understanding what are the types of conditions that you experience based on where you live. The solution isn't to move people to better places. The solution is really to improve the experiences of people in place. And so my work that predominantly focuses on parks and green spaces looks at all these different types of outcomes that can be derived based on where you live. And so your access to a green space does result in tremendous benefits that have to do with both physical and mental health, but also these other things that are harder to measure using data, but we see in everyday lives are things like social. You get joy and happiness and connection to people when you're connecting to parks and green spaces. And that's something that has profound health effects as well. And then the core area that we're talking about here is really on the environmental side. So understanding what does it look like, not just for individual benefits, but also community health benefits when you are located close to a park space. And I will say that I've been struck that in DC, the Trust for Public Land has recently named DC, I think the third year in a row, as having the most equitable access to parks, and as measured by a 10-minute walk to a park. And at the same time, DC has great health disparities. And so trying to do that connection to understand what is the experience of people on the ground, those are some of the core tenets of my work.
That's great. And I mean, I would say from how far you walk or distance, yes, we do have a lot of green spaces. I think the question is, number one, whether or not people feel like they are welcomed in those spaces. Number two, folks have time to experience those spaces. Like, one of my favorite parts of DC is along the Anacostia River and the trails that are in the Anacostia Park. And right now it feels like a hidden gem. You don't often see a lot of people there. And I'm worried. Like, I want to tell people, yes, please go visit and use the trails and all of that. But then at the same time, I'm like, no, but I don't want too many people to know. Because it's such a beautiful, serene space where you don't feel like you're still in the city, and yet you very much are. And it's in walking distance to a lot of the communities that we're talking about, but whether or not they're taking advantage of it is a completely different question that I hope that we can explore more. In your role at the Urban Institute, you lead the Research to Action Lab, which provides technical assistance and training to local governments seeking policy solutions in the health equity space. What are some of the best practices that you're excited to bring to the commission's work?
I think one of the predominant things is really in that name of the research to action. So trying to understand what are the data showing, what are some of the recommendations that are data-driven, evidence-based, and then how do we apply that to the types of decisions that are happening on the ground. One of the key things that the Research to Action Lab focuses on is the audience. So we are talking about local change makers, and I purposely use that word because the decisions aren't just made by local government, they're also made by leaders of community organizations. They're also made by residents. And so considering the entire ecosystem of who benefits from these types of solutions, and then use that to go back to the data to understand how do we extrapolate that and then also translate it in a way that's usable on the ground for people who are solving challenges right now. So that sort of middle piece of understanding what's happening in people's lives and then connecting the evidence source and the data to that, that's sort of the core practice that we have within the Research Action Lab. And I'm hoping as we continue our conversations, that's something that I can bring to the table as we are considering options when we're looking at these health disparities in the district.
Okay, we're excited about that. Ms. Jones, I often say that for the district, we are resource rich and coordination poor. We can say that in health, capital, school, all the things. We are resource rich and very coordination poor. Your nonprofit promotes healthcare patient navigation and trying to do some of this coordination work. Can you speak a little bit about what you feel like is the lack of coordination or access to care that's happening for women in particular east of the Anacostia?
Yeah, I would agree with that assessment and agree that it is happening in so many areas. We have one of the things that we found with breast cancer, it's Breast Cancer Awareness Month still, is that there's relative parity in terms of screening. But when we look at mortality and how many Black women are dying versus their white counterparts, those rates are abysmal. Now, there are a lot of spaces that have navigators. There are supports around transportation and food assistance. But for some reason, that is not having an impact on care. Sometimes when we talk to some of those providers, they can't get women to come into their facilities. And so what we are looking at is what is most important, what's effective. And I think what we found is that near peer approaches and contacts are really effective. And what we want to do is link those to the systems and the resources within systems so that more women have access to them. And I know that we're working in cancer, but it's not just in cancer. I believe that similar approaches can be used if we're looking at even food access. And I know we absolutely, Ward 7 does not have enough in terms of grocery stores. Yet there are also wonderful networks that are working. They're not permanent and shouldn't be replaced. But for instance, Lederer Gardens is a beautiful community where there is food that's fresh, it's high quality, and there's a real community of elders who are in that space for anyone who's able to get there and go through. So how do we make those connections of the resources that we have, those that are filling the gap until we get what we need, and those that are actually working in ways that the system should work for the long term? I think it's really by having people with different insights at the table to do that.
Yeah, which is why I'm so excited about you all as a group in terms of joining the Commission on Health Equity. Dr. Halseal, you are the one reappointment amongst this particular group. What are you hoping for in sort of this next iteration of the commission?
Yeah, that's a really great question, and I think I probably would need to go back to my initial thoughts when I was appointed. But I'm really hoping that this commission can take a holistic viewpoint of health equity in the district and do things like conduct research and pull in data to help really identify the disparities. I know that there was a health disparities report that was produced some years ago. It was phenomenal. Many researchers I know depended on that report and some of the wonderful information that was in the report. So definitely hoping that the commission can dust off that report and issue a new version of that report. And so also hoping that the commission can help to influence policy. I think there are a lot of different opportunities to strengthen and improve our existing policies that, in my opinion, will go a long ways in reducing health inequities in the district. So definitely looking forward to the commission working to, take the data that's gathered and put forward some real viable policy solutions that could really be used to help move the needle a bit more. And then also one of the things that I'm hoping the commission will get an opportunity to do is really start thinking about how do we establish a framework for monitoring and evaluating our existing health equity initiatives and determining just how well are they working. And so I think you mentioned there's a lot of stuff happening, but unfortunately there is just, as you mentioned, a lack of coordination. And when you have that lack of coordination, it's very difficult to determine the impact as a whole on district residents, as well as what's working and what's not, and where resources might be best, used. And so I think that would be a really good focus area as well.
I'm glad to hear you talk about sort of the ongoing monitoring and evaluation of like if what we're doing is actually working. In a previous hearing I had with DC Health, I think one of my frustrations is like how the lag of data sometimes is 2 to 3 years. And I'm like, okay, well, like, once you tell me, now by the time the data comes out, something else new is approaching. I think often of a conversation we had, we did a hearing on maternal health last year, and I'm hearing from doctors and nurses who are telling in real time, here are the concerns of what they are seeing today, right? Around a rise of substance use disorder in terms of pregnant women, a rise in terms of perinatal mental health, and some of these other and community violence as impacting maternal health as well. And I'm like, okay, I won't actually see the data from DC Health on this for like another 3 years, and there might be some other new thing. So how can we like be better and using that? And I would also say too, wanting to see the commission be able to ebb and flow regardless of a pandemic or some other emergency, because I feel like we lost time. The fact that we haven't had a health equity report since 2018, we have lost time. And so I want to thank all of you so much for your willingness to serve. And I hope you're ready to get to work, because I tell Dr. Arno anytime I see her, like, there are things that need to happen. And I'm glad we have the right group together. Austin Hicks, who couldn't be here today, she's a food policy expert, so sort of going to some of the things that you were talking about, Ms. Jones. And then, Ms. Garces, she also does a lot of work in terms of behavioral health. And so I feel like we have a really good group, and I just want the commission, if we can move these nominations as quickly as possible so that everyone can get to the table and get to work. Thank you, Mr. Chairman.
Thank you. And I have no further questions for you all. I want to thank you all for your, in the case of Dr. Hausfield, your service on the commission, and for all of you, your willingness and commitment to serve going forward. The record in this matter will be open for 2 weeks. That is, anyone who wishes to submit comments, or if any of the nominees here want to submit something supplemental, and I'm not saying you need to, the record will close at 5 p.m. on Wednesday, November 13th. I'm going to adjourn the roundtable, and we will schedule a new roundtable or hearing for the 2 nominees who could not make it today. The time is 11:01 a.m. Again, thank you all, and this roundtable is adjourned.